County Board of Health meeting. It's Wednesday, April 1st, 2015, and I'll call this meeting to order. Would you all please stand for the Pledge of Allegiance? I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Could we have roll call, please?
Kathy Bruck.
Present.
Terry Williams.
Here.
Maggie Wilcox.
Here.
Dr. Wynn.
Here.
Supervisor Jean Bishop.
Here.
Frank Labarge. Dr. Hendricks and Donna Williamson are absent, and Larry Carver and Margaret Nyberg are resigning.
Okay, since we don't have a quorum, we cannot approve the minutes, so we'll delay that till the next meeting. We'll continue on. They have the CD update. Christy?
Good evening. Okay, so we're going to talk a little bit about our communicable disease investigations that have taken place over the last few months. Each of you have a copy of the summary of reportable diseases that reflect the case counts for the first quarter of 2013, 2014, and 2015. That's compliments of Anna Scherzer, our epidemiologist. And just as a reminder, the numbers reflect the case count as opposed to the actual number of investigations, so it does not reflect the caseload. Okay, so I want to highlight a few events that have occurred this quarter. We continue to provide case management and our directly observed therapy for a TB case that was identified late in 2014. In February, another TB case was identified, and so we conducted a case investigation, contact investigation, and have provided case management and DOT for this case as well. Both of these cases have required extensive case management as a result of complex medical issues. During the first week of March, we received a report of a third TB case. This individual had been symptomatic for quite some time, but not diagnosed with TB. We launched a contact investigation and found that this individual had considerable number of home, work, and social contacts. Our team was in the community holding after-hours clinics and working well into the night to identify those that had been potentially exposed to this case. As of today, there have been 150 contacts identified, and we are still testing many to see if they have actually been exposed to TB. During the same week, we were notified of a traveler that had returned from West Africa and would require public health monitoring for 21 days to assess for Ebola symptoms. This required a team of 2 public health nurses to provide daily face-to-face contact with this traveler. The monitoring was successful, and as of Monday this week, we've completed the monitoring, so all is well. Also that same week, we were notified of a lab-confirmed pertussis case that had been in our communities during their infectious period. This was a student who was reported, it was actually transported to and from school with multiple contacts that were unvaccinated. These contacts attended 3 different schools, and the case did not live in our jurisdiction, so we had to coordinate our efforts with 3 different jurisdictions just to make sure that the contacts were identified and that the follow-up and medications were provided as needed. There were 48 Mohave County contacts associated with this case. Within a few days, we received yet another report of pertussis. In one of our neighboring communities, it was also in a school setting. There were 11 contacts identified with that case through that investigation. And interestingly, we were notified of that first pertussis case the Friday afternoon before spring break. So all of the schools and our district offices were closed. So we've had a really good working relationship with our schools and our school administrators. And, just as an example of how important those relationships are, we were able to contact the school administrators while they were on vacation. Some in Florida, we contacted them. But we were able to get contact information for staff and students, and then we could contact them while they were at home and provided, again, the education and medication so that we didn't have the spread of pertussis when they all returned back to school. So, as you can see, the month of March has not been very kind. These events have occurred in addition to our normal disease reports. Now, typically, when we have moderate or large-scale investigations, we're able to move throughout, resources throughout our county to address these issues and to ensure continuity of our public health programs, such as our immunization clinics. We really want to continue our immunization clinics during a disease outbreak. So, it's really important that we continue with those services. But we do have 2 public health nurses. They are core public health nurses in each of our communities. And they're responsible for investigating these 88 reportable diseases that Arizona says that are reportable. And they're also responsible for following up for these emerging infectious diseases that are occurring, such as, they're not on the list of this 88, but they're chikungunya and Ebola and, all the things that are emerging. They're also responsible for conducting our immunization clinics, both the adult and childhood immunizations. They participate in our family planning and our STD clinics, as well as they make home visits for our medically fragile infants through our newborn intensive care program. They also respond to such a variety of public inquiries. So we have a very strong and knowledgeable and experienced team, one of the best in the state, truly. That this team has been struggling to keep up with the number of disease reports that have been submitted and the additional requirements that come with each disease investigation. The events and the timing of these events that have taken place this month has really taken its toll on our team and on our medical director, Dr. Nguyen. We need, as we go through these investigations, when we have testing or new procedure strategies that need to be done, it requires us to have a conversation with Dr. Nguyen pretty frequently, with our medical director. And, this can be pretty difficult, obviously, to have multiple inquiries from public health just to be able to keep our community safe and, at the same time managing a busy practice and hospital responsibility. So really want to take a minute to thank Dr. Nguyen for his efforts and his support of our team. So just to give you an idea, the impact of these events on our team, and the nursing employees document each week, actually each day, the number of hours that they spend in each of our public health programs. So just to give you an idea what this response has meant to our team. From July to December of 2014, so for a 6-month period, our team logged 241 hours in our TB program. So when they've participated in various efforts through the TB program, they document those hours, 241 over a 6-month period. In one pay period, which is a 2-week period, when we were experiencing these disease investigations, we logged 161 hours in the TB program, just in that 2-week period. So if you compare what we've done in 6 months versus what we did in just those 2 weeks, that's considerable. So we've had both of our nursing supervisors and myself as the manager out in the community conducting clinics and helping with the investigations. So, when events like this occur, other normal disease reports, they are prioritized, obviously, but it takes months sometimes to get caught up on some of those investigations. When there's a delay in those investigations, we may be putting our community at risk. So Patty and I have discussed, the needs, the need to increase the infrastructure of the nursing program. And we have a temporary solution to address this immediate need of these disease reports that are pending, but we're also working on a long-term plan, that we'll bring back to the board soon. So we just wanted to take a few minutes tonight to notify you, to let you know about these events that have occurred, to let you know that some of the challenges that we faced over the last few months, and to also let you know that we have challenges ahead as well. So with that, that concludes my communicable disease report for tonight, and I would love to hear your questions.
Yes. Can you tell me how far behind you are right now?
Right now, we have over 300 diseases that are pending.
Wow. And how long will it take you to catch up, do you think?
It depends. It depends on how many resources we can gather to address that need.
Okay, thank you.
I have a question. How are nursing, public health nursing resources allocated? How is that? Is it per population? Is there kind of a standard as far as how many nurses per 10,000 population or anything like that that's kind of a best practice, if you would?
There has not been a standard, and that is, it varies between counties, between states, and just across our nation. It really does vary, and there's been a lot of research done on this, and I think they're trying to establish some of these criteria, but there is not a current standard. So right now, we have the 2 public health nurses, both in Bullhead City, in Kingman, in Lake Havasu City, and then I have a part-time nurse in Colorado City. Interesting enough, I've worked for the county for 19 years, and when I started working for the county, we also had 2 public health nurses
That's what I'm wondering.
in each community.
So our population's like almost doubled in that time, but not our nursing staff. Correct. How do we compare with other counties in the state as far as public health nurses?
We've looked at, our ratio of public health nurses, and each county, each jurisdiction does things a little bit different. And so it's really hard. We're not able to compare, straight across the board. So some may have nurses they may report that they have 16 nurses. They're part-time nurses, and they do not participate in half of the programs that we have. So, it varies so much that it's really hard to create that standard.
Thank you.
Sure. Other questions?
Nobody else? You have a question?
Just as a comment, you can see a lot, in the recent year, we see a lot more disease and a lot more spreading of these disease because we travel more as society. We do cross-boundary, cross-border. However, as society and especially here, we don't think much of preventive care as important. You treat condition when the condition came in. It costs a lot more when you treat something when it's already happened. Primary care service is shortage. Public health service even more shortage because there's not so much focus on the preventive care. Insurance company, for example, I think out of our insurance company, Kaiser actually thought about it and they do a pretty good job at preventive care as a structure because they see the benefit of saving the insurance company in the long term. It's a awareness and we still have to work constantly. Healthcare worker work 60, 80 hours a week is norm nowadays. A lot of hard work. But I really appreciate the nursing staff. I will do anything that you need me to because it's the community we live in. We have to. And for some of these conditions, for example, tuberculosis, I'm pretty passionate about it because I grew up in an area where tuberculosis is a widespread, but a treatable disease. And treatable and individual education is very important.
Yes, indeed, it is.
That's all
Thank
I have
you.
to say.
I had one other question about the TB cases. Were those 3 cases in any way related with each other, or were they isolated from each other?
They were isolated.
Okay.
We do have some information that perhaps one of our cases was linked to a case back in 2013, but we're still working to verify that.
Okay. Thank you.
Thank you.
Okay, we'll go up, update on the strategic plan.
Almost 2 years ago, we needed to redo our strategic plan at the department. And in the past, our plan had been a lengthy document. I'm sure you've been part of organizations that develop strategic plans, and they're not usable documents, really. They're lengthy, they end up on the shelf, and most of the staff has no idea there is even a strategic plan. So, in short, we decided that we wanted to make our strategic plan a more usable document. So I started doing some research on strategic plans and usable documents, and it just so happened that the State Health Department had hired us some consultants to come in, and they shared their strategic plan with all of us. And I really liked it. It's one page. There's some support documentation, but it's one page. So we asked, I called the consulting firm and asked them if they could help us, and they were cost prohibitive for us. So I called the State Health Department. I said, is there any way you could share your information with me so that we could come up with the same type of a document that was usable? And they said, we've got an even better idea. We'll provide 2 people to come up and provide you technical assistance. So 2 members from the ADH team came up, and they spent 2 days with our management team, and we came up with some overarching goals and the main draft of what I'm going to show you in a minute. Then we met with our department supervisors, and we spent a day with them seeing how they liked it and what they wanted to add and what they thought didn't work. And then we presented it to all of our team, all of our staff. So in 2014, we finalized that strategic plan, and it looks like this. It's important to know that this strategic plan we have it printed, and every staff member has this as part of what they keep at their desk, so they can see how their job fits into this. That was important to us. So you'll see that we have our vision over here on the left, your right, and the mission. And we have 4 overarching goals. We want to impact Mohave County's winnable battles. We want to strengthen the Mohave County public health system. We want to maximize our effectiveness as a department, and we want to promote and protect community safety. And then under each of those, we had 5 key components. And you probably don't remember, but your first Board of Health meeting after the elections a couple years ago, we did go over all of this. We just didn't show you this one-page document. So we have 5 key components under each of those goals and in the target areas. And then the 4 blue areas at the bottom are constants. They apply to all of the measures. So if an employee works, for example, in the nutrition area, we're going to have measurable goals. I'll get to that in a minute. And they can actually see how their work every day fits into the bigger scheme. And I think that's really important for all staff to see how they fit into the bigger picture. After we developed our strategic plan, we then realized we needed to develop a performance management system that's based on the strategic plan. And this is a diagram that's used frequently by the National Association of City and County Health Officials and by the National Public Health Performance Institute. But basically what you have here is performance standards. You develop those, and then you look at measuring those. And as you measure those, you do it on a quarterly basis or a yearly, bi-monthly basis, however you decide to measure it. And you see how you're working towards those goals. And if something's not working, it gives you the opportunity to say, okay, this is not how we thought it would work. And then you can develop quality improvement projects to look at why that's not working and tweak it a little bit so that you can start to get the measurement that you hoped that you would get. And it also allows you to report your progress better, and that's been one of my concerns for a long time now, is I feel like our department, we have teams, nursing as an example, that does an incredible job, but we don't report it enough. We haven't had a system for tracking it and letting you know, our Board of Supervisors know, and the public what we're doing and being able to show it in a concise manner. And so I'm hoping one of the outcomes of this is that we can come back to you on a regular basis and say, look what we're doing here with some of these measurements. So as part of our performance management, we reviewed all the programs within our department to see what's currently measured, because a lot of our grant programs require us to measure things, and then those that are not required, we also have measurements for many of them. So we currently track them, but we just haven't looked at them regularly, or, as I said, communicated that to the public. So we are going to we have set up a system to formally track what we currently measure, and then over the next 6 months, we're going to review those measures and look for barriers, see what progress we're making, et cetera. We're also going to make program changes, and if we think something needs to be tweaked or we're not seeing the kind of outcome we want, we will consider that as a QI project. We have both a performance management team now, and we have a quality improvement team. And I know these all sound like trendy words. Sometimes I hear myself and I think, this just sounds like jargon, but I really honestly feel like this is a foundation to set up that will help really improve our ability to show progress on, I think that's this thing. Sue, is it? No? It will help us to improve our ability to actually measure what we've been doing and accurately communicate it to everybody. Let's see here. Our future plans for our performance management system will include reviewing all of our programs where we don't have current measures and to develop them, and then also develop measures to show improvements in our communities. We kind of did that with our CHIP. Terry knows about that, our community health assessment, and then our community health implementation plan. But we still need to strengthen that, I think. And now that we've done it once, I think those of us who've been involved with it know what needs to happen the next time to do it even better. So all of this is a learning process for us. And back to the jargon stuff, I think it's a jargon, but I think this is providing a lot of really good infrastructure for our department to build on. In addition, so as part of our performance management system, we aligned it with our strategic plan, and we looking at 4 goals right now. The first one is to improve maternal-child health outcomes, and we're looking at 2 different areas under that: immunizations and breastfeeding. And then we are also chose another one, working towards accreditation standards, and we're doing two QI projects. We did a time card study, and we're also looking at our environmental area, and we're standardizing our food establishment reporting, because we discovered that all of our food inspectors had a different way of reporting. And so we decided that needed to be standardized for a variety of reasons. So we're looking at that right now. And these are the kinds of things we will be bringing back to you when we're complete, to show you what we've done. In addition to those 4 things that we as part of our strategic plan that we're focusing on this year, we always have that ever-present goal, and that is to fulfill our statutory, regulatory, and operational requirements. And as Christy just mentioned, there may be instances for the need for additional investment in public health if we cannot fulfill these statutory, regulatory, and operational requirements. I think Dr. Nguyen hit it on the head when he said that, we're seeing more and more disease outbreaks and more communicable diseases, and a lot of them are brand new. So the public is afraid of them, and public health has to take even additional time to try to figure out how to get ready and prepare for them. Ebola as an example. So I think that we will need to monitor this really closely and come back to you with a plan for how we're going to address this in the future. I think all of these plans, our strategic plan and our performance management plan, will help us to better articulate what we do and be able to show the change that is being made by all public health in the county, not just our department, but public health in general, which includes the hospitals, the doctors, physicians, everybody. Comments, questions? Yeah. Yes, that is something we can do within our budget right now. If I will have to fill out a bunch of paperwork and go to the Board of Supervisors if we decide we need to hire additional nurses as full-time.
Okay, so you do have funding for that, for a full-time?
For temporary? No, not
For
not
temporary.
For temporary.
But it almost sounds like you need
For full-time, we would
permanent.
have to request additional funding from the Board of Supervisors, and as you may have heard, the county's in a world of hurt this year, and
Right.
actually, we're being asked to cut our budgets by 5%, so you have to clearly think something like this through before I would be willing to go to the board, but this last several months has been, as you can hear from Christy, they have been working weekends, nights. It gets to the point where you can't have people continue to do this, and you put the public at risk at some point.
I'm assuming you're paying in overtime?
No, just, yeah. Yeah, the training is, my concern with the temp or bringing on new people is very few people have a background in public health, especially in nursing. So there's a huge learning curve with bringing on a temp or even a new nurse to try to help with communicable disease surveillance, because there is so much information you need to know, and there's such a huge amount of learning. And what Christy didn't mention in all of this is a lot of this requires directly observed therapy. If they're diagnosed, we still have to have a nurse go and see them every day, take their medicine, so it's a huge amount of staff time. So the training is definitely an issue. Okay, I hate to start out with sad news on a presentation, but I wanted to let you know that it's a little over 2 weeks ago, I had a bad day in public health. Rachel Patterson, our environmental health manager and our accreditation coordinator, resigned. She decided she got another job in Texas, and she decided they had made some family decisions to be closer to family. So she is not with us anymore, and we are currently recruiting an environmental health manager. But I wanted to let you know, because she's been a solid member of our team for 10 years or more and an outstanding manager. She will be sorely missed, and it's a huge loss to the county as well as our department. So I wanted to let you know that. She was going to be here tonight to present this health impact assessment that they did for the Rotary Park in Bullhead City, and because she's on her way to Texas, I'm filling in. So hopefully I can answer your questions and we'll get through this together. I was aware of all of this going on, but I wasn't prepared to give the presentation. If you just remember one thing throughout all of this is health impact assessments, and what we're trying to do in public health now more than we've ever done in the past is we're trying to make the healthy choice the easy choice. And that's kind of what a health impact assessment is all about. In the summer of 2013, Rachel and I had a meeting with Supervisor Moss to talk about some other issues. Actually, we were orienting him to environmental health because he was a brand new board member. And he mentioned that he was doing a lot of activity with the Rotary Park in Bullhead City, and there was an expansion planned. And about that same time, the State Health Department asked the health officers at one of our meetings, was anybody interested in doing a health impact assessment? And we had been educated briefly about them in the past. So I said, if nobody else wants it, Mohave County's interested. So we were awarded a $20,000 grant, and we offered to Supervisor Moss that we could make this Rotary Park the recipient of the health impact assessment, the first one that's ever been done in the county. And because we were under a grant, a really quick cycle, it was called a rapid HIA, because we had to have the results done in 3 months. So just a little bit background about Bullhead City. It was founded as Hardyville in the 19th century. I think this is kind of interesting. It was a small frontier town, and they operated and started out as a ferry service across the river. Kathy probably knows more about this than I. You want to come on? Current population is 39,571, and they were incorporated in 1984. Tourism is the main economic resource. 21% have a poverty rate as compared to Arizona's rate of 17.2%, so there's a high poverty rate. And there's about 21 acres of parkland per 1,000 residents, some of this obviously being very rough and undeveloped desert area. The Rotary Park is 211 acres. It was first developed in the early 1990s, and they've had 2 expansions, one in 1995 and one in 2011. The Rotary Club, obviously, with the name, was instrumental in the development, but there have been other organizations that have made large contributions, such as the American Youth Soccer Organization and Supervisor Steve Moss. As part of our process for doing the health impact assessment, we conducted a park audit. We went out and observed the existing facilities. We looked around, and then as you're observing and looking at stuff, you ask yourself, can we provide new information? Would this be a good project to take on? Can we add value? Will this health impact assessment affect the community's health? And Rachel and her team were able to add yes to all of those. Here is a map area of the assessment area that we looked at with Rotary Beach, and the following few slides are pictures. It's a beautiful park. If you haven't been down there, it's amazing. I did not know it was there, and here I've been in Mohave County for who knows how long, but I didn't realize because it's over a ways towards the river, and it's a beautiful park area. As you can see, there's a trail, there's facilities for picnicking, there's baseball parks, there's a skateboard ramp area, there's playgrounds for the kids. I don't know, Kathy, what do they use that big auditorium area there for?
It's a big ramada, and they have lots of community events there, and
Beautiful.
They do, they have Easter egg hunts and the regatta, you name it, they have it.
You can see the nice trails, beautiful area. Back to some stats. As you can see, Mohave County doesn't fare well when we look at our disease and our behavior here. We have a 31.7% rate of obesity as compared to Arizona's rate of 25% and the U.S. as 27%. Our physical inactivity rate is 30.4% as compared to 20% for Arizona and 23% for the U.S. Our heart disease per 1,000 is 235. And diabetes, 10%. You can see here we exceed Arizona and U.S. standards. Not good. So one of the first things that you do with a health impact assessment is you scope the surrounding area, and you you get interviews with key stakeholders, which Rachel and her team did. They sent surveys out to the surrounding neighborhood, and they also interviewed neighborhoods along the transit lines. And they developed a pathway diagram based on the feedback from that. The neighborhood they surveyed was within a half a mile of the park, and there are 2 transit lines in Bullhead City, so they accessed those people along those lines to see how much they use the park. And as you can see, these diagrams are always kind of overwhelming when you look at them, but basically they're taking all of that stuff and looking at it and seeing if you were to do some of these things, what would be the health outcomes? If you were to expand the athletic programs and increase the number of the fields, what could potentially be the impact of that? And as you can see there, it would be a lot of great impact. When we did the community health assessment and our community implementation plan, one of the things we looked at was in many of our communities, there's a lack of community, and especially it causes a lot of risk behaviors in our youth. And isolation like this can lead to risky behaviors, as we know, like alcohol consumption, tobacco use, and drug use. A strong community, the opposite of that, increases those protective factors. It helps tie you to family and your community, and it also helps to provide a clear moral code. And substance abuse and mental health were clearly identified in every one of our communities as one of the top 3 problems that we face here in Mohave County. Also identified were the youth risk and protective factors. So, would the addition of athletic fields to Rotary Park increase the sense of community? And as you can see, 58% of the respondents believe that it would have a positive impact. The existing fields that they currently have right now accommodate at least 1,000 kids playing soccer and 1 league. But if you were to add on to that, you could have multiple community events, and the park director estimates that they have 60,000 visitors to that park a year with soccer league and tournaments and stuff. So Supervisor Moss thinks it's not only brings business to Bullhead City, but it's great for the youth. Get a lot of visitors from that. More stats. Physical activity. We know our obesity problem, but physical activity, 30.4% of adults in Mohave County are physically inactive. 60% of our high school students in Arizona do not go to physical education class. And 40% of high school students, and this is by CDC, so this is a US standard, play video computers or use a computer for 3 or more hours every day, which means they're not being active. Some of the comments that they received from the health impact assessment, there was a ton of them, but she selected out a few here. Along with the bike and walking trails, a fitness course would be a healthy choice. We need to do more things to get healthy. So community residents identify with the need to try to get more healthy. We just need to make it easy for them. Currently, the park has age-appropriate playgrounds, walking and biking paths, a golf area, a skate park, a dog park, horseshoe pits, basketball and volleyball courts, softball, baseball, and soccer fields. But with even more space, the connectivity between the walking and biking paths and fitness stations and distance markers, it would add a huge amount of ability to get active in the park. So the question was asked, which would increase the likelihood of you using Rotary Park? And as you can see, having the public transit stop there, which it currently doesn't, would help. Bike routes, added parking, added athletic fields, fitness stations, and other things like distance markers would definitely increase the likelihood of people using the park. Foot and bike traffic to the park, when they looked at that, the number of people walking to work dropped from 2.9% to 1.3% in Bullhead City. There were 12 pedestrian fatalities in Bullhead City and 24 in Mohave County in the years 2008 to 2012. 2 bicyclist deaths in Mohave County in that same time period. And surveys in the immediate area indicate that 52% walk to the park, but there are still 17% bike to the park, but there's still a large majority that drive to the park. Somebody suggested that it would be nice to have a sidewalk all the way around the park, as I have to walk in the street or the dirt to get to the park trail around the riverside or the lunch area. Kids walking in the street is also a concern. It's located in a densely populated neighborhood, and so one of the things that we're concerned about there is noise and air pollution and lighting. If those strong big lights are on till late at night, that can be a real problem for people in homes trying to sleep. But when they looked at, I mentioned this just a minute ago, but when they looked at people walking to the park, 50% say they still walk there, but 31% still drive. And that's within a half a mile radius, sorry. How do you access Rotary Park? Just another way of showing that although the majority are still walking, there's a lot of people still driving. I mentioned the noise and the light pollution. That's a huge mental health concern. You don't get good sleep when that's happening. We have the 4th highest suicide rate in Arizona, and we report 4.2 mentally unhealthy days per month as compared to the Arizona standard of 3.4. And here's a resident saying, I live near the park with the lights on every night. It's never quiet, lots of traffic and noise. it's already a little bit of a problem for people. So these were the recommendations that the team came up with. To construct additional fields, sports fields, this would provide currently there's competition for field space, and there's minimal access to fields by adult leagues because the kids are using it. And so they have plans already underway to develop additional 38 acres for soccer, football, and baseball. Another recommendation would be to construct sidewalk and bike paths connecting the neighborhoods to the park. Apparently, the city has future plans to add sidewalks along one of the major roadways adjacent to the park, but current bike paths and sidewalks exist outside the park, but they don't connect to paths within the park. So it would be nice if we could get connectivity between that, because we can show in other communities when you provide that connectivity, people utilize it a lot more. Currently, there's no public transit stop at the park, so it was recommended that public transit look at providing a service area to a central location within the park that would be closest to several blocks from one of the main entrances, and it would allow people to be able to take the transit to the park. It would also decrease the amount of motor traffic in the area. It would hopefully lower air pollution, decrease gas consumption, and it would also be a way for the young and our seniors to be able to access the park and utilize it. Another recommendation was to add pedestrian crosswalks within the park. No crosswalks currently exist, and it's used year-round for multiple events, so the traffic congestion can be heavy, and so sidewalks would be a definite added benefit. Another recommendation was from a lot of the walkers that use the park already, is add distance markers so they can tell how far they've walked. That's, speaking as a walker myself, that's helpful because not everybody can afford a Fitbit or whatever to measure how your 10,000 steps a day. So they wanted distance markers, and then they also wanted fitness stations along the walking paths. 34% of the respondents indicated that would increase their use of the park. You're all aware of what those fitness stations are like, right? They have them in Rotary Park in Havasu, and you'll walk for a certain distance, and then they have a machine that you do, and it strengthens your arms, a different part of your body. And so they're all along the track. You can use them or you don't have to, but they're great for adding some additional fitness to your routine if you're walking along that area. So those are really helpful. Apparently, there's a little bit of a problem with dogs, so the recommendation was install signage describing the responsibility of dog owners and the consequences of noncompliance. That 62 patients were hospitalized from dog bites in Mohave County in the years 2008 to 2012, but that's all of Mohave County. But the record indicates from the police department in Bullhead City that 23 bite incidents occurred in the past 5 years in this area. So there's apparently a high concern and priority to the surrounding residents about dogs wandering not on a leash, and they're concerned for safety. So that was one of the recommendations. And then hopefully work with the residents to coordinate active recreation programs to minimize the noise and light pollution impacts. And another issue, even though it's probably a liability issue, would be to designate swimming areas along the banks of the river so you could enjoy the water. The next steps, involvement in the general plan update, which we have continued to do. We have made formal statements to our general plan here in the county, and we've also made formal plans to the Lake Havasu City general plan. We haven't done it with Bullhead yet because I'm not sure when their meetings are, but as soon as we find out, we will be doing that in Bullhead City and in Kingman. We've met with Bullhead City officials. We had several meetings there. We didn't get a large turnout, but we had, I think it was 5 people, and the vice mayor, I think, was there, and several of the city officials, and they really felt like this health impact assessment was a really good place to start and give them the momentum they needed to perhaps apply for funding to help with making the healthy choice the easy choice. So we want to keep this on the radar of decision makers. Comments, questions? This is the first one we've ever done. According to Rachel, it did take a lot more time than she thought, but I think that it was a valuable process for us, and I think we are available to do these for other programs if people, our communities have a need for something like this. We are trained in it now, and we are available to do these if you know of other instances where a health impact assessment might be useful.
Well, I thank you. I think you did an excellent job, and even stuff that I didn't even know when I lived there, so it's great. This is a great report. Thank you.
It was, yeah, I think they did a tremendous job. I wish she was here so I could thank her.
Yes, thank you. Anybody else?
I agree, Patty. It's very impressive, and I learned a lot, too. I had no idea Rotary Park was that large.
I didn't either. I didn't even know Bullhead City had a Rotary Park, because I live in Havasu, and our Rotary Park there is wonderful. I utilize it all the time, but when I was there, I was like, wow, this is just amazing. I can't even imagine on the weekends when all the kids are there playing soccer and everything. It must be an incredible thing, Kathy, because
You should see it. When we have the soccer tournaments, there's 5,000 kids there. It is absolutely amazing.
And you want to double it.
And they're building
So-
more right now as we speak.
Yeah,
So, I mean,
and
it's
so
just-
you have soccer, you have families coming in from all over the state, and I don't know, maybe other states even,
Yeah.
to play soccer, which is great for kids, for families, and it's also helping tourism, so,
And it's spread out. I mean, you have the soccer fields are up in this area, and you go down here, you have the skate park, you have the dog park, and there's just people everywhere.
and the river's right there,
And the
so
river's
it's
right there.
beautiful.
It's just wonderful. So if anybody ever wants to come see it,
Yeah, I highly recommend, if you haven't, when you go to Bullhead City next time, if you haven't seen it, to go over and look at it. It's incredible.
I was going to ask no indication of air conditioning or misters, and then you just called attention to the fact that the river's right there, so I
Yeah.
guess you can jump in it. But Bullhead City and like Havasu in the summertime, it's got to be hard to get out and be active, and
Yeah.
and the lights in the evening, that's the only time that you could
Right.
enjoy the park in the summertime. But I wanted to ask you how much of the $20,000 value was spent in putting this together. Did you need all of the money, or was that sufficient?
Yes. I think in terms of staffing time, we utilized most of that and then the printing costs and putting it all together and everything. I think Rachel felt like it's costly to do it, and it was more timely. It took a lot more time, I think, she said, than she thought it would.
And then what will become of the study? I mean, now, where do
Well,
you go
we've
from here?
presented it to the community officials and to Supervisor Moss and Supervisor Angus, and now they can use this when they apply for grants or when they ask for additional funding. A lot of federal and state resources now, when you ask for money for things like this, they want to see that you've done a HIA. So it is now available for them to use when they request funding, to say, see, we've done this, and this is why we need this to help improve our health and to make health the easy choice. So hopefully, that's going to happen all over the United States. These will get done, and it will help for funding agencies to see how these improvements can really improve a lot of other things than just activity for kids.
Is Rotary Park a city park or a county park?
city.
City.
Okay.
City.
And I wanted to know, is Rotary, were they presented with us at their meetings, or were they present when it was
I
presented?
think they were invited, but at the meeting I was at, I do not think anybody there was representing Rotary, but we would certainly be happy to, perhaps I should call and see if we could present it to the Rotary Club, that since it's the Rotary Park, that's probably a good idea.
I think that would be great,
Yeah.
because they've done all the fundraising and they've done all the work on this.
Yeah, so they might, not only will they might even be able to help more with funding if they could see how the additional support would even get more activity.
Well, I know, I think they're still working on it.
Okay.
So they're still fund driving for that.
We'll give them a call. Is anybody on the Rotary and Club in Bullhead City? I think Supervisor Angus is. I'll find out. I'll do that.
Okay, anybody else?
It's really great to see the improvement. It increases the sense of community. Here you point out two very interesting concepts in preventive care and health is walking. Walking is so important. They have study out there, and you can Google it out. 15 minutes 3 times a week. I always tell my patient, take a walk. It's good for your mind, good for your body. 15 minutes 3 times a week. It's the same at a lot of other exercise. I also like the concept that you mentioned, the fitness station. A lot of big city look into that. It's not just a soccer field, you know, 64 years old don't need a soccer field. But by walking, those fitness stations increase range of motion, help with your arthritis, your joint, your knee,
Yeah.
prevent a lot of complication down the line. So those are concepts now in preventive care in community, large community, they're looking at. Sidewalk is very important and make individual feel
And it's
safe.
harder to do. I mean, I participate and watch a lot of webinars on walkability and helping communities become easier access for exercising and activity. But it's hard in the large rural areas like this because when you have subdivisions and you can add little park areas and walking trails in there, it's a lot easier than trying to figure out how to connect, for example, Rotary Park in Havasu to places uptown and everything. It sometimes becomes a real issue, but I think if you bring it up constantly and you focus on it, I know right now, I just read in the paper yesterday as an example that Lake Havasu is forming a trail committee, and one of their tasks is to figure out how to connect all these things and where we need to have pieces of trails put in to connect to the others so people can walk easier to places instead of always driving their car. You know, I'm a big walker, so I get up every morning at 4:30 to walk, so I get my exercise in before I start the day because I know what's going to happen. But I encourage my staff to take their breaks and walk around the buildings a couple of times because it is so important, and just about everybody can walk. It doesn't take any money. I mean, you have to have a pair of shoes, but, you know, children, seniors, everybody just about can walk, and it's a great form of exercise and mental therapy. So it works for a lot of things. Thank you for your comments.
Anybody else? No? Okay, thank you, Patty.
One more thing I just
Go ahead.
wanted to address is that we've got some agendas for the next few meetings, but if there's something specific you would like us to address, when you first started 2 years ago, you gave us some ideas of things that you wanted to have us present and talk about, and we've pretty much gone through that list. So if there's a health topic or an issue that you would like us to bring forth for information and discussion, give me an email or let me know, and we will look forward to that. But I think our July meeting will be on our emergency preparedness program, what we're doing for that. We haven't talked to you guys about that, and that's a really important part of our response. So, but please let me know if there's issues or public health concerns that you would like us to address with you in the future. Thank you.
Okay, is there anybody from the public who wants to address? No? Any comments from anybody else? No? No? Then I will adjourn this meeting. Thank you all.